Hi, I hope you have been enjoying your visits to either the WIC, the school nurse, or to occupational health. And I just want to go over what the paperwork looks like for that, what the impact reflection is. And so that for you is listed under the content, under the clinical, and that's where you can submit this as well. So it'll just simply be a way for you to reflect back on the experience and be able to share that with me what happened. So I love if you include specific examples or that kind of thing of your experience because that just is kind of nice for me to get a sense of what the experience was like for you. So it starts out with APA format. So you'll start with the date, the time, the place, and the setting. So just that's pretty straightforward. The purpose or the focus of the care, that you, if they give you a brochure or if you go online or use your textbook to see what that kind of health, public health nursing. So for example, school nurse, what is school nursing, kind of what's the goals, what's the objectives, what's the purpose of it. For WIC, you would want to put some history with it. When was it established, kind of the goals, that kind of thing. So that you typically will put a reference with, and that is kind of what that part is. The defined community, if you look in your book, page 397, 398, talk about what community is. The first two, when it talks about the group composition and the group dynamics, that really refers to what community is. So where it lists clients and it says community there, you really have probably already addressed community in the group aspect, the first two parts of it. But the composition of the group, think about the people, the place, the function. So think about culture, ethnicity, kind of the social identity, the group dynamics. How do they interact? Are they supportive? How do they function? Kind of what activities are going on there. And then the clients is where you'll address specifically the aggregate, or that is what your population is, or what does the group share in common. And then at the family level, and remember, family, it doesn't need to be the traditional family. It can be made up of multiple people and factors. And so look at that, and then the individual. And if you want further definitions of what those are, look in your textbook. If you look in your um, index at the end, it will guide you to that. So then the next part is the core functions. And the core functions, when you did your last assignment, when it looked at community, the community as client, the core functions fall under there. And these are three things that public health nurses really need to make sure that they are including along with the 9 essentials that you addressed in your paper. And so they are assessment, assurance, and policy. If you look in your book on page 6 and 7 in your textbook, it'll spell these out for you and give you examples of them. And so assessment is really just how do they monitor the health status, what kind of diagnoses do they have, and the policy development is informing, educating, and empowering the people about health issues, mobilizing the community, and developing policies, procedures, and being an activist. So I hope you all went and voted yesterday. Assurance then is how the laws are enforced or regulations, making sure that there's an adequate workforce, and evaluating the services that you have as well. So if you have questions about that, let me know, but you should be able to address each one of those. So and so then just say assessment, I saw this way, I saw assurance this way, and I saw the policy as well. So, and then you can also tie that into um, the model that's at the bottom of the page, the Laffrey and Kolbeck. If you want to look further at that, page 387 in your book addresses that, but it's really how to promote community health. And the focus of it is to help you to recognize that there's continuity of care at various levels, and that it's the client system, the community, aggregate, family, individual, that they're separate yet connected, and how that ties in with the focus of care, which is preventing illness. How do you promote it? And then what actual illness care did you see as well? So, and also very much to think about collaboration, and what kind of partnerships are there between healthcare and the population as well. Then you will address Healthy People 2020. And if you look at the back cover of your book, it talks about that there. You can also go to just Google Healthy People 2020, and it'll list the objectives for you and the key indicators. And so there's like a Healthy People 2020, there was a Healthy People 2010, a Healthy People 2000. And so every 10 years, they have different health indicators, and it's looking at what, as a nation, should be our health priorities. It has baselines, and then where we're at, and then the goals where we hope to be in 10 years. And so there's objectives listed, and then leading indicators as well. So if you go look at it, I think it'll help you. It'll help you figure it out. Or there's different examples in your book as well, like 987 in your book looks at it in regards to a faith community looking at older adults, and it just lists for you some of the things for prevention are like to make sure that older adults have that their chronic health conditions, that they feel like they're able to manage those conditions more, um, reduce the number of older adults who have severe functional limitations, or increase the proportion of older adults that have less physical or cognitive function, and that gets improved by the use of exercise. So, like I said, and you'll see that in various chapters in your book as well, that it'll tie in what the Healthy People 2020 looks like with it. So, and then address, so where you visited, how does it impact primary, secondary, and tertiary prevention? And so primary is, think about it, that's before it actually happens. So, for example, those will be things like immunizations or education. If you think about how a number of years ago you could smoke anywhere you wanted, and now it's pretty limited where you can smoke when you're in a public setting. And so that's something that, because we know the effects of smoking that it can have on cardiac health, if we can prevent people from developing it. So think about primary is before the disease is even there, and we're just totally doing what we can do to make sure that people don't develop things. So then secondary then is when you might detect or treat in the very early stages. Often it's before there's even really signs or symptoms present. So with secondary, think about S, secondary screening S. So typically, if it says anything about screening, that's going to fall under a secondary category. So, but so that can be things like, think about how we do blood pressure clinics, or your community probably offers maybe like stroke prevention. And so you can go in and get your diabetes, or get your blood sugar checked, and get your blood pressure checked, and your cholesterol levels. And so they're hoping that if, then if you have something, they're catching it in the very early stages before it really has a huge impact on your health, and then that you can manage it so it stays at that level. The tertiary, then I kind of think of that as damage control. So that's, you already have it, you have signs and symptoms, but what can we do to make sure that you have optimal health? So it's kind of living with the condition that you have. So things like rehab, chemotherapy, or screening. Like I said, screening typically falls in secondary, but if you're screening for complications, then that could fall in the tertiary as well. So, and then the evaluation. Just tell me, what did you learn about this experience? So what did you learn about the services that you didn't know before? Maybe think about how could you connect that with something that you do in your workplace. Think about holistic health. How can this program that you got to be a part of for a few hours, how can that impact the health of the community? Think about person-centered care, that holistic care, when we're looking at the mind, the body, the spirit, and then interdisciplinary practices as well. And then, of course, your references and your APA format. So hopefully that helps with this a little bit, what it's supposed to look like. I know there's a sample paper in week 4 as well. And as always, if you have any questions or anything about it, don't hesitate to ask me. So, all right, have a good evening. Thanks.